Okay, so it's August 18th at 7:41 p.m. We're going to currently call together an informational gathering of the Board of Health. If we have a quorum, we'll go into session at that point. But for now, we'll start with the director.
Okay, yeah, we have to skip over approval of minutes since we don't have a quorum. So again, I've been out all but 2 weeks since June 16th, and so I don't have anything extensive. Just that last week before I went out, we did have some strange closures of the beach, and not strange, I should say. We just had some elevated sampling results that due to rain that kind of timed with the time of sampling that kind of we had to open and close things, and so it was a kind of an odd week, but the rest of the summer's been fairly good. I was able to participate in a Connecticut Public Health Association public health mixer event at Two Roads, where they had public health students and seasoned professionals come together, and they kind of plunked the seasoned professionals at tables, and people kind of rotated through, and so it was a very very good experience. I thought I enjoyed it and was able to talk to about 10 different students to sort of help them figure out where they think they may want to go and what their interests are, and where you could use that in current public health workforce. And then we continue with this past month. We've got a lot of blight complaints, so we continue to spend a fair amount of time on blight complaints. And had our Board of Condemnation meeting today, and we're sort of moving ahead, trying to resolve all those. Do we have somebody just join us?
Hey, it's Henry Yoon.
All right, Henry. All right. So,
hey, Henry, so we're officially in order now?
Now we have a quorum, so we'll
43.
Go into official meeting. And so that's really my report. Henry, you missed it. It was really good.
I'll have to get the highlights later.
Yeah, you have to listen to it, yeah. And so we'll move right on to Santina. So I asked Santina to present, since she was actually the acting director of health for 9 weeks this summer while I was out recuperating from surgery, who's in Florida calling in on her vacation.
Yes. Hi, everyone. So, and I didn't burn the place down, so I'm glad the health department's still kicking. So just a few things I wanted the board to know about was on June 23rd, the health department participated in the Road Safety Safe Street Alliance launch that was at the library. It was really well attended. We had some state delegation there as well to speak. And we've been working really closely with the Safe Street Alliance, helping them come up with social media content. So Emma Sharp from the health department has been really helpful with creating the content and then, making it on Canva. So we're proud to be a partner of that. Also during the summer, we had a summer intern. He is an MPH student at Fairfield U. So he was with us from the end of May to August 6th. And his primary role was doing the water sampling. So every Monday he was doing samples, and he would do resamples if necessary on Wednesday. And then during the off time, he collected 10 years worth of data to try to see if there were any trends in the water quality. Unfortunately, there weren't, but it was actually pretty interesting and neat to see all of the information kind of in one place. So that was a great project. And then he worked on a PSA for explaining to people why we do the water samples from Memorial Day till Labor Day. So we wish him the best of luck. He was great, and we're really happy to continue partnership with Fairfield U to take on additional interns. While Sans was out, it was also the end of grant season, so a lot of our grant reports and financials had to get in. So our immunization grant ended on June 30th. We did, have to send back about $30,000. It was not spent, and we will be losing our part-time immunization nurse and our community health worker, which they knew that, the grant was temporary. But that grant is all done. Our ELC2, we expended all of the funds by May. Emma Sharp was on that grant, and we're now transferring her to our per capita and our workforce development. Our report for our workforce development grant was also submitted, and because we had Emma on ELC2, we didn't expend any funds. And then finally, our preparedness grant was submitted. As far as emergency preparedness, on August 13th, Emma and I attended a public safety tabletop at Fairfield Fire Training School. And they kind of went over communications and radio communications. That was pretty neat to be a part of. And that's in preparation for a larger scale exercise that we're going to be participating at on September 16th on Sherwood Island in Westport. So it's part of the Region 1, so it's going to be a really, really big exercise. So we're excited to do that. And then, drum roll please, we have figured out our flu clinic dates. So October 1st from 10 a.m. to 2 p.m. over at the Fairfield Senior Center. That one's going to be targeted more towards our seniors. So we'll offer, specifically high dose, but we'll have, regular dose for them as well. We're hoping to get COVID and pneumonia. So, that's really kind of going to be advertised for the seniors. And then for our bigger clinics, we're looking at October 15th, again at the Senior Center, and October 16th, again at the Senior Center from 11 a.m. to 7 p.m. And that we will put it out towards the schools and social media and press releases and the whole 9 yards. But that's our target for right now. And I think that's it.
Okay.
Great. Sam, welcome back.
Thank you very much.
And Tina, thank you for joining us from vacation. And we won't be offended if you want to get back to it.
Yep.
No, you mean with my 3 kids who are arguing in a different location? I'm okay right now. Thanks.
Well, we're okay if you stay on to. And the meeting went till 10, so you know.
Sure.
Me next. So today was actually the first day back for all the school nurses, so that was good. This summer has been a huge focus on staffing. I'm happy to say we are going into the school year fully staffed. We have 3 new full-time nurses, 2 new part-time nurses, and 2 new subs, as well as I have a new nursing coordinator. My previous coordinator has retired, so I spent a lot of the summer working on staffing and hiring. I also spent a lot of the summer with the coordinators revamping.
Hi, we had someone join us. Is that Sally?
Hi, it's Sally. Do you still need me? I just saw that email come back.
We actually have a quorum. Henry called in after we reached out to you. So if you need to go, that's okay, but you're welcome to stay on.
Okay. I didn't want to ruin the meeting, so I'm sorry. I just saw it, but I'm at Illicit watching the game with a lot of people in Fairfield, but
Okay.
I would forego it if needed. So if it's
enjoy the
okay,
game.
I am
Enjoy
going
the
to
game.
forego this one. Okay. Sorry about that, but thank you. Okay. Bye-bye.
Bye.
So I spent a lot of the time this summer really revamping our new nurse orientation and training, in part because we had some new ones, in part because I've been here almost a year now, so I could see the holes in the areas to fix. The coordinators helped me a lot with that, which was great. We also revamped the sub-nurse training, and I also created a new welcome back orientation for all the things that have to happen to open a school. So that's been a huge part of my focus. I've had a lot of meetings also with Fairfield Public Schools talking about parent communications and some of the big hot button topics like the one we're talking about next, and getting those communications out to parents. We had one go out last week about kids not carrying medication on themselves in schools, needing orders, that kind of stuff. That's the main thing I've been working on the last few months. You want me to go right into the life policy?
Well, if the chair is okay with that, yep.
I mean, that's the next thing on the agenda.
On
If
the
you want to
agenda.
speak to it, go right
Keep
ahead.
talking.
Yeah, go for it.
So the current policy that we had hasn't been looked at since 2014. In the 2012 to 2015 time is when the CDC, American Academy of Pediatrics, National Association of School Nurses all really came out strongly. And mass screenings didn't work, and they also were a waste of educational time. We haven't been doing those, but we have been doing a lot of communications still, sending out emails, classroom specific when there's many studies out there that have shown they haven't worked. Fairfield's one of the only towns still sending them, and we still have lice, so we're an example in its own. If there was an amazing thing that we could do that send out and get rid of lice for life, we would. So I've just basically revamped the past policy to include that it's not a health hazard, it doesn't transmit disease, that we're going to follow the advice of the CDC, the American Academy of Pediatrics, and the National Association of School Nurses, which is really basically when we identify lice, we notify parents. When the parents have the option to pick up the child if they want to, but they don't have to. That's been about a 10-year plan from the CDC also. Then we can give the parents educational materials, and we can work it through them with them directly, but there isn't really a need for classroom-specific. Not only a need, it identifies children who should have the right to confidentiality, it increases stigma, and it just does not work to stop the spread. So I have a letter ready to go, assuming that all of this is approved. I've met with Bruce McDonald, medical director. I've met with the superintendent of the school. I've met with the head of communications, writing this all to just communicate all of that out to the parents, what we do, also provide them resources on how to check their kid, really encourage that they're checking their children weekly, especially when they're younger, and the things you can do, keeping your hair back and that sort of stuff. So you've got the entirely redlined past one. It even was filed away in the communicable diseases section of the manual, which is not really where it belongs either. I have the new policy, which hopefully everybody's had a chance to look at, that just references following the evidence-based procedures or advice, and then the procedure document that we'll keep in our manual that we can change and update as we need to, that has some links for parent material. So it's all sort of wrapped up in there.
And so you're looking for a motion to remove and replace the current policy with the two documents that you've provided, the shorter red version and then the procedure document.
Yeah, the procedure document I can put in the manual. I think we talked about this with the last one, trying to sort of separate out procedure from policy within there. So the policy references that there is a specific procedure and that it'll be based on the American Academy of Pediatrics, National Association of School Nurses, and CDC advice. Just if, for example, the communication method were to change, or the links were to change, or any of those things, and the parent material were to change, to not have to come before the board to vote, but to keep that procedure active and up to date.
So you're requesting a motion for that?
I'm requesting a motion for that.
So do we?
Do I hear a motion?
Yeah, and Sarah, I like that you have called out in the policy the National Association of School Nurses, AAP, and the CDC. You're like, basically, this is who we would go to anyway if any updates to the procedures would occur. So I think that's really good.
Great, thank you.
Sophia, was that a motion to?
Yes, it's a motion. Did anybody motion in the room? I'm sorry, I couldn't tell.
You're making a motion to replace the existing policy with the new policy and to add the procedure manual? Okay.
Yeah.
Just wasn't clear.
I am making a motion to adopt what Sarah has proposed in the policy that she's outlined in red, and to refer to the manual, and then to remove what she has crossed off in red in this proposed lice attachment.
All right.
And then a second.
I second the motion.
A second. Before we vote, I do have a question.
Yes.
We'll have a discussion topic here. Are the three organizations typically in alignment on this particular policy? I think especially now, the CDC, as we see the government sort of stepping away from other standard practices in some ways.
They have been for the last 10 years.
Okay. Do they typically collaborate on this and write it together as like a joint statement, or?
The way it is right now, they each have their own statement about, the CDC doesn't even so much have a statement. They have a decade ago a recommendation to not make students go home from school for things like this. Mm-hmm. The American Academy of Pediatrics has published several papers that outline the evidence-based practices that school nurses should follow, and the National Association of School Nurses always refers back to the AAP.
Okay, so it all sort of jives together in a different way and creates a whole document. Yeah. Cool. All right, well, we have a motion and a second. Is there?
Oh, I'm sorry.
Oh, go ahead, Henry.
Sorry, just a question for discussion, being that, head lice is the bane of any medical advisor's existence when it comes to
Yeah.
schools. Question, because I've heard them all. In the procedure, I think you alluded to this under two-parent guardian notification. You mentioned there'll be the third bullet point, no grade-wide or school-wide notification, which I think is absolutely the right thing to do. But that doesn't preclude classroom notification, correct?
No, yeah, we're not going to do classroom notifications. Is that what you're
So
asking?
you're not doing. Well, that's what I'm trying to get. I thought I heard you say that you would do classroom, but you wouldn't do grade or school-wise. But if you could just clarify that for me.
Meant the individual.
Yeah, so the individual students' classrooms, we're not doing notifications. We can do grade-wide or school-wide if that's decided between the school nurse, me as the nursing supervisor, and that school administrator. Like if we reach a point where we need an entire grade email sent out or an entire school email sent out, we still can do that. But the classroom notifications have long been recommended against, as they do end up identifying students and creating a lot of stigma.
No, I agree with you wholeheartedly. But as you know, that provides, there are a lot of people that will give pushback, right? I mean, they want to know when someone has the flu or a strep throat or whatever. Is that something you think would be worthwhile putting in that as well? Just clarifying no classroom grade-wide or school-wide notifications will be sent unless directed by the nursing supervisor in conjunction with the school nurse and school administrator due to an unusual cluster of cases, or do you just not want to identify that as a potential friction point?
I can put that in there if you want. The classroom notifications are definitely ones that we would. I don't know if there'd ever be a situation when we would do a classroom notification. There might be situations where we would send a grade-wide one. There might be situations where we would send a school-wide one, but we would not probably ever want to send a classroom-wide one, as it just does hit too close to home, and you can quickly figure out who went home and
who it is. Yeah.
No. I agree with you wholeheartedly, but someone's going to ask.
I understand what you're saying, to clarify it in here.
Yeah. But that's completely up to you. I don't feel so strongly about it, but again, only because, I've heard it, right? I've had to deal with it.
Yeah.
Why don't you tell the rest? Someone gets it in class, I want to know, so that I can check my kid at home. So I just wanted to point that out, and whatever, I'll defer to whatever your judgment is, because I'm not the one that's going to get the phone calls. So,
I think I was writing that to be in line with an email that I was working on that's going to go out, assuming this is approved. But let's just add that in there, and then it'll make it clear.
Well, let me just discuss this, but by adding it, it makes it permissive if the supervisor decides it. And
Right.
You're saying
Oh, I thought he meant to add a sentence saying we will not be sending classroom-specific ones.
a separate distinct sentence to say there will be no classroom notifications?
Yes.
Is that what you're saying, Henry?
Oh, well, some indication there. It just makes it clearer for parents. But then again, it also highlights the fact that you don't plan to do that.
Yeah.
And some people may get just worked up seeing that. What do you mean you're not going to do that?
I think it's the way the sentence starts, the no grade-wide. Like, I think if I say no classroom-specific notifications will be sent, grade-wide or school-wide notifications will only be sent in the case of, the nursing supervisor, school nurse administrator, that second sentence or third sentence.
Right.
I can make a change
So,
to that.
I think we would need,
But I'm just changing it in the procedure, which is not in the policy part.
so
that
the
we're-
Policy.
the board isn't approving the policy.
I mean, I
Or
appreciate
board
the
is.
feedback on the policy,
Yeah.
but yeah.
Well, could we say, Sophia, would you be open to amending your motion to say as amended by adding the aspect of no classroom notifications?
Yes. Yeah, I think that's fine. So,
Thanks.
do you want me to say it specifically?
I think we got the gist of it in the conversation here.
Okay.
with
Sounds good.
discussion.
Is there any further discussion?
And then,
There is.
yes, I'm sorry, Jason. I think apologize.
Good night.
The only other question, I promise, this is the only other question I have. Under
Okay.
the return
My
to school
favorite topic.
criteria, the return to school criteria.
Yes.
First bullet point, students may return to school after treatment has begun. So I just want to be clear. When we use the term may, that suggests that that they don't have to. It's a two-part question, actually. So my question is this: do students have to be treated in order to return?
You know what? That is a very good question. They should be treated before they return, but the method of treatment can be as simple as the manual extracting it or the chemical stuff that they put on there. But when school nurses call and notify the parent that the child has lice, they do say they should be treated, but they can come back tomorrow. So it's really just saying your child should be treated that evening and then can come back the next day.
Right, because I think especially in Fairfield, don't we have I don't want to say alternative lice treatment methods, but that sort of manual removal as a treatment mechanism, or
There, yeah,
I thought there was someone.
Yeah.
Right, there are those that are out there. So again, I'm not about to I'm not passing judgment on the merits of one treatment versus another, but I wasn't clear if this meant a student must be treated in order to come back. But we're not gonna tell them what they have to be treated with.
Right, we're not going to tell them
Right.
what they're going to. We talked about it at our staff meeting today also. I mean, with any questions, we're directing everyone back to their pediatricians, of course. And so students who are recently treated by chemicals, they may not be appropriate for them to be treated by chemicals anymore, just treated through manual, combing out of the hair that the parents can do also. But that's still technically a treatment.
Right. Okay, so this statement is accurate the way it is. Students may return to school after treatment has begun.
Yes.
Yeah.
Okay. Great, thank you. That's it.
Anything further? All right, do we have any opposition to the motion?
As amended.
As amended. All right, hearing none, it carries. Enjoy your policy and all the feedback you will receive.
Thank you. I know. Thank you. That's the next step. Part of my staff meeting today, we also talked through bullet points of what to say to parents when they call, hoping that my 40-plus school nurses can talk to some people so I don't talk to everyone.
Mm-hmm. Sarah, I'm happy to help. I've heard lots, so I'm happy to help. I can do like a mock phone call.
Yeah, that sounds good. If there was some magic thing that we could do to get rid of lice, we certainly would all be doing it, because school nurses hate it probably more than the parents. But
yeah.
So Sophia, was that a motion to add your personal phone number to the bottom of the policy?
Stan?
That's what I heard. Everybody seconded it,
I'm here as an external resource, right?
Right. What about like a social media post on it?
Yeah, I think that's needed at the start of the school year, especially. Yeah, I think that's a really great idea. And also just to reduce the stigma of it, because a lot of parents don't realize that it's gross, but it doesn't spread illness.
yeah.
And that a lot of the over-the-counter chemicals are ineffective now. And so really manual combing, unfortunately, is the best way to get rid of it, just like over and over and over again.
Yeah. We do, and to that end, we do have a letter ready to go, and an email that the superintendent has already agreed to, that we're going to communicate what our policy is and what we're doing in the schools already. And then, because I'm just such a planner, I have another one written and ready to go out in a few months when we want to just remind everybody to check your kids' heads again. And we're just going to go with the education method.
I would
Yeah.
if you're going to social media route too, shut off commenting.
Yeah.
It might just be in your best interest.
Oh, yeah.
That's a good point. Yeah.
Don't even let them go there.
Yeah.
Yeah.
And then the health department, didn't you all do a video last year? That was really good.
It's been
Yeah,
a couple of
so-
years, but we linked to that in another email
Yeah.
that
Excellent. Yeah.
written and sent out when we do have to send a grade or classroom-wide one this past
Sure.
year. I linked to that video in there for parents who want to watch it.
Mhm.
I think most parents will appreciate the fact that they're getting real, like, advice, that they don't need to panic.
Yeah.
They don't need to worry that the device is transmitting disease. I think
Yeah.
that's what people are worried about. So
Yeah.
Yeah. Exactly.
those two things, I think, are the key
Yeah.
to getting through, all of this.
Yeah.
Hopefully-
And also stressing that we are sharing this and we are also parents who have dealt with it as well. So,
Yeah.
It's like, we've all been through it, rite of
Yeah.
passage.
Right.
But I think that resonates with a lot of people.
Yep.
Yep.
It does.
So our last agenda item is communications. Does anyone have any communications?
There are none?
I'll be a little, a little different, I guess, in communications and maybe offer a communications outwards. If the meeting minutes could just reflect outwardly that I think the board should offer its condolences to the Gerber family, just on the passing of our former first selectman.
Sure.
And the tragedy to that family. The board certainly offered the sympathy and condolences.
Be added.
Otherwise, we can't have new business because this was an otherwise unplanned meeting.
Do we have the minutes? We didn't vote on the minutes,
Oh,
so that
yeah.
would be,
yes, thank you.
yeah.
And we have our minutes to approve. Do I have a motion to accept those?
Motion to accept the minutes from the prior meeting.
Okay, do we have a second?
I'll second.
Any opposed? All right, hearing none, minutes carried as written. And that is it, so I'll entertain a motion to adjourn.
Motion to adjourn.
All right.
All right, so moved.
Thanks, everybody.
Anyway,
Thank you, guys.
Enjoy watching the baseball game.
Thank you.
Great.
Thank
Thank
you.
you.
Bye.
Bye, thank you.